I'm not sure. He put in a couple of them.
Did you put in Dr. Kennedy?
The version was filmed with last night, but he sent you something.
No, he said he put it on box.
Last night?
As far as I know, he hadn't told me that anything's altered, and it looks like the one that I was dealing with yesterday.
Really good. A few things came up here, and dates and stuff in
Well, I made copies of it yesterday, so it'll be wrong on their copies. I know. Yeah, there's 43. Yeah. Okay. So do you have yours on here?
It's awesome.
Okay, there's yours. Okay.
So,
Okay, I'll go over
So I did instructions for our group activity.
Okay.
So there's a program here that says it has
Okay.
a video to your portfolio, these two files for the instructions.
Okay.
I printed it, so I'll have it up here, but I thought you should have it.
Okay. Okay.
So my name is David Chaplin. I'm the co-director of the Training Academy here at the CCTS. We're going to start in about 3 minutes. Actually, our lead-off speaker is on his way from another early meeting. So, but in the meantime, I just want to seat you all. If you didn't sign in when you came in, please do sign in on the touch pads outside. You might want to do it now. We have a few minutes. So I think you all know that if you attend 80% of the sessions, we give you a certificate of completion. This is how we keep track of whether you're here or not. And for the people who are joining us online, as you enter the GoToMeeting, you'll have an opportunity to put in your email address as part of your registering, and that will allow us to get you signed in also. So I'm not saying that you should disengage now if you're connected already, but for future meetings, assume that everybody was here for the first meeting, but for future ones, when you log in to GoToMeeting, please put your email address in. So one other ground rule thing while we're getting ready to start. So this is the first year that we've had a third of the participants joining us online. So that's a challenge to us to try to make sure that we can engage everybody in the discussions that we hope to have here in the library here in the PCAMs. It is in most ways easiest for us to manage engagement of the people who are off campus if you can manage your own ambient noise and not have a lot of noise in your background. The best thing is for you to mute yourself if you're not actually trying to speak. If I have laptop with control here that if I hear too much background noise and it's disturbing the ability of the group here in PCAMs to operate effectively, I'll have to mute you all myself, and I will try to put in the chat box that you have on your GoToMeeting a notice that you've been muted. If that happens, I'll be monitoring the chat box, and if you have a question you want to make, type it in. If it's too complicated to type in, just put in a note that you'd like to speak, and I will find a time to interrupt the discussion here and unmute all of you so that you can participate. I hope that makes sense. Also, I just wanted to make the point that the room here is fairly large. We have ceiling microphones that work fairly well, but not perfect for the people out of the room. So we have a couple of handheld microphones that we'll be passing around. So if you are off-site and you're not able to hear, please enter in the chat box that comment, and we'll do our best to make sure that we get the volume turned up. Anyway, we'll be ready to start in a couple of minutes. Thank you.
Can you show us how to go to the GoToMeeting site to attend some?
So you will, if you, I think Jean only sent the instructions to the people who live off-site, but if you're interested in being able to do that, you can email Jean Lambert, which is Jean L, Jeanl @uab.edu, and she'll make sure you get put on the email list for the GoToMeeting login. So it's, if you've ever used GoToMeeting before, it's just, it'll be the same, except that you'll have a particular link to go to. If you've not used GoToMeeting before, it requires you to download a little bit of software that's perfectly safe for your computer, and then just click in login. It's very simple. It works on Macs and PCs pretty flawlessly. Okay. So I need to go to meeting instructions so I can be watching the chat box. Thank you so much. So while we're waiting for Dr. Kimberly, so I'm going to go ahead and introduce him now so that we don't waste time once he gets here. So Bob Kimberly is the Holly Professor of Medicine in the UAB School of Medicine. He's Senior Associate Dean for Translational Research at UAB. He's the PI of the UAB Center for Translational Science Award, which was called the Center for Clinical and Translational Science, the CCTS. He's a well-respected rheumatologic researcher. His main interests are in the genetics of lupus and other disorders that have immune complexes as their a major part of their pathogenesis. And so he's really the person who helps organize this whole operation. I'm going to pass out now just the schedule for the course. You'll see it's divided into 6 modules, plus at the very end we have a mock study section where we'll be reviewing a K award, and it'll give you a sense of exactly what goes on in an NIH grant review committee. So I really encourage you to make sure you get that on your schedule. It's really one of the highlights of the program. But I'll go ahead and pass out the other parts of the schedule. I'll describe it a little bit more. We're going to have 2 parts of the presentation today. So Dr. Kimberly will take the first part. We'll take about a 5-minute break, water break in the middle, and then I'll have about another 20 minutes of comments to make at the end. But in the meantime, you can have the schedule. Straight back to the middle. Great. Good morning. So We can change your slides from last night. Okay. We're going to have to wait up there. It's too bad. Okay. So one other thing I should just make the point. So most of the people who are participating in this course are doing it out of the pure interest in learning about translational science, but this also is a credit course called EPI 680. So if you're here for EPI 680, you're in the right place. Okay, so we're trying leaving the participants offline unmuted. See what happens. Let's Kimberly Z. I'll step up here and here, and then I'll just go through the box for questions, and we'll use these so that you can hear questions that come from here. So I already introduced you, so we won't waste time now that you're here.
What'd you say? Maybe we should ask these guys.
I tried to be polite.
And you want me to wear the mic here? Yeah, okay, we can do that. So guys, thanks for your patience. I'm obviously coming from a different meeting. The day starts a little earlier than 8 o'clock in the morning for some of us. But I'd like to reinforce Dr. Chaplin's welcome for you joining us. David, have you talked about the number of people who are coming in online?
I haven't given any specifics.
Okay, and the number is 20?
I think it's 17 online.
17 online and
6 here.
Okay, so the reason for raising that is this morning we're going to probably do something a little bit different than the standard PowerPoint. And it's going to be a little bit of a challenge because roughly half of the class is sitting here in the room. And the other half of our group, I'll call it a group, I much prefer that rather than in a term like class, is coming in virtually. So look around the room. Do you know why people are coming in virtually? Do you know who that is? I see a couple of yeses and a couple of nos. Yeah. Who's coming in and why?
Distance. I think we have some partners that are not in the local area.
Mm-hmm. So this is a program that's run by the CCTS. And while we have the hub of the CCTS in Birmingham, we actually are a network of 11 partners over a 3-state region. And what you probably have no way of knowing is that the number of people who have expressed interest in this particular program that kicks off today has now hit a new record. We've got 43 people with half coming in from our partners around the region. I think this is actually rather astonishing because what that tells us is we're beginning to think a little bit differently. We're beginning to realize that our questions and opportunities they're not all self-contained within one building or within one institution, but in fact, some of the translational challenges, I might argue all of the translational challenges and opportunities that we have, we can really think about in a regional sense. But I don't know if you guys heard what Dr. Chaplin asked me when I came. He said, did I change the slide deck? Have any of you ever given a presentation with a slide deck before? No? A couple of yeses. Yeah, I hope. And has anyone ever changed your slide deck without letting you know exactly what they did? That's what he did last night. So if
Payback.
right, if there's some hesitation, just realize I may be seeing some of these things for the first time. That's okay, it's fun, and I hope we've all had a chance to have some coffee. So, welcome to all 43 of us, if that's the right number, at least 5 different institutions, 17 departments and divisions, at least 12 different disciplines. It depends a little bit on whether we make the distinction between pediatric hematology oncology and adult hematology oncology. But the point is, we're a really diverse group. That's an opportunity. It'll be a little bit of a challenge, but please bear with us this morning. So what are the goals today? The goals are really to set the frame for this program, to talk a little about what is translational science. We're going to talk about role models for translational science. I have one favorite that I hope is still on the slide deck. We'll see. And some opportunities and challenges for all of us in this domain. So what I'd like to do is take a few minutes to have us all introduce ourselves to each other. And that's going to apply not only to folks who are in the room in PCAMs, but to everyone who's online. And you probably also heard the comment, we're totally unmuted, and so far the audio is working well. There's not a lot of unwanted feedback and background noise, so I think this may work. So David, do you have a microphone?
I do.
That we can use?
Yep.
So what would I like? If you take 5 minutes to do this, we're going to spend the whole 2 hours. Now, I'm sure that will be interesting on one level, but I do have a few other things we'd like to cover. So if you can be pithy, but as you are being pithy, if you could say your name, your institutional affiliation, and your role. The people who are with us today range from full professors, full professors. Who knows where full professors, when they come into a room, where do they sit or stand? Are they? In the back. Right in the back. And I see one full professor who's about to duck, so he doesn't. Alan, thank you very much for being here this morning. But what your role is, what your academic discipline is. Why are you here? Okay, some of you I know for filling an epidemiology course. Courtney, welcome. And then something that probably puts the first person at a bit of a disadvantage, but all of you have a chance to think about this, a paper you'd love to publish. It could be one you're working on, it could be one you haven't even started to work on, but what would be the tagline for that paper? I can think of, for myself, a couple that I would love to. Haven't quite gotten there yet, but that's the aspirational part of this. So again, pithy if we can, a little more pithy than I've been, but see if we can spend a few minutes at least getting a little bit to know each other and the diversity, because we'll find we go from graduate students, residents, young faculty, more experienced faculty, all kinds of folks are here this morning. So go ahead.
So you won't hear like the microphone's working. It's only for the people online. So don't worry. Just hold it up
So
like it's
carry forth.
My name is Samir Rana. I am a postdoctoral researcher in cardiovascular division. By my background is behavior neurobiology and cardiovascular science. The reason for joining this course is that I'm in a training grant in basic and translational science in heart failure. That's one part, and another is my interest too. As for the paper, I have no idea right now.
So since you're kicking off, and thank you for being so gracious, excuse me, that's my coffee. If you want later on this morning, we'll give you a chance to come back. Or if you don't have it by the end of the morning, you can do it next week. Okay?
My name is Ben Jackson. I'm a postdoctoral researcher here at UAB, Department of Neurosurgery. I'm definitely interested in this course for long-term goals. Translational research is an interest of mine. And a paper I like to publish is something related to Solid tumors, bye-bye.
Okay, so. I don't know how to say anything.
Good morning, everyone. My name is Meredith H. I'm a postdoctoral fellow at the Department of Nutrition Sciences, UAB, and my research area and interest and the area in which I would like to publish is comparing nuts versus nut oils for cardiometabolic disorders. So,
Good, thank you. Courtney.
My name is Courtney Peterson. I'm Humera's mentor. I'm an assistant professor in the Department of Nutrition Sciences. I might drop in on a few lectures.
Please
to
do.
enrich myself, and I'm an early career faculty member. And I'm going to finish up a paper today on meal timing and how that affects how many calories you burn and how much fat you burn.
And just if I can add a quick sidebar, for those of you who get your scientific information from newspapers, might it be the New York Times or the Wall Street Journal, Courtney was published in the Wall Street Journal, what, 3 days ago, 4 days ago? So there are all kinds of venues to get our information out. Go ahead.
Hello, my name is Beatrice H. People just call me Betty because I'm from Greece and it's typical. I'm an assistant professor in the orthodontic department of UAB. It's my first year. I just signed my contract actually. I'm clinical emphasis, although maybe that's weird. I really like research, and that's why I'm here. I have already a project that's related to reevaluate how we treat smile in orthodontics. The first part was to do my systematic review, which I did, and I tried to publish in the most well-respected journal in orthodontics, and I just got rejected. So I think I really need this course.
Welcome to the club.
Good morning, my name is Gina McCaskill, and I'm in the Department of Medicine. My role is complicated. My academic discipline is social work. Reasons for joining this course. I'm currently conducting a small feasibility clinical translational science project that I didn't know was clinical translational science. And so I would like to receive formal training in clinical translational science because I'm self-taught. And the paper that I would love to publish, it's kind of corny, but I would like to do write a paper with my mentor, Dr. Ball, on the methods of conducting a clinical and translational science feasibility study.
Good, thank you.
Hi, I'm Colleen Ball. I direct the Center for Translational Research on Aging and Mobility. So we do all kinds of studies on improving cognition and physical abilities and look to see how that impacts functional performance in older adults. I'm a mentor for Gina, and I'd love to publish a paper on our 20-year clinical trial showing that we can improve Alzheimer's outcomes.
Good, thank you, Carly.
hey, I'm Lydia Marcus. I am a 5th-year child neurology resident here at UAB. I am taking this course because I'm trying to learn some clinical research skills, and I'm hoping to publish eventually a paper on a case series of acute flaccid myelitis in children.
Good, thanks.
I'm Crystal Lewis. I'm from the University of South Alabama. I'm an assistant professor in the College of Nursing. The reasons for joining this course was I started my PhD program in 2007, which was right when clinical translational science became a thing. And so I never got any formal training, and I now work with the medical center at USA, and I'm doing a lot of like implementation science that I've never been trained on. And I'm doing a lot of interdisciplinary work with instrument development, and then trying to take that into actual, does this make develop instruments, go to the, does it make a difference? And I'm like, I'm not really sure how to do that. Paper I'm working on right now is a case study applying institutional betrayal and trust theory to rare disease patients and looking at the structure.
Good.
Hello, my name is Ilaria, and I'm an MD from Italy. I came here, joined Dr. Beer's lab. I'm working in ovarian cancer research now, and since I'm an MD and not a PhD, I think this course is really important for my formation to law school. And I would like to publish something on ovarian cancer.
Good.
Okay.
Well, welcome to UAB and to the CCTS.
I'm Jane Ness. I'm a child neurologist. I'm partners in crime with Lydia. And I took the CCTS as a new faculty in 2001, and thank God it's at 8 instead of 7:30. And the paper that I'd like to publish is looking, this pie in the sky, is looking at the influence of adverse childhood experiences on neurologic disease, and my case is developmental disease.
Can I grab the microphone for a sec? What we thought we'd do, I'm looking
Unmuted.
at...
Dr. Kimberly, unmuted. Unmuted. It was muted.
I see some concerned faces in the next row. So we're going to give you a chance to think about the paper you want to publish while we ask some of the folks who are online to introduce themselves. David?
So I think to try to avoid chaos, I'm going to read off the names of people who I see here who have joined. So you'll need to unmute yourself. So the first person is Anna Wilk. While Anna is unmuting, if that works for her, I'm going to I have a chat box participant, Kathleen McCoy, who is in the University of South Alabama, associate professor in community and mental health, and wants a strong underpinning in translational science applications. Her dream paper is Correlates of Wellness, Habits, and Career Satisfaction, Success, and Patient Outcomes, and RN and APN faculty.
So David, it sounds like we have someone coming in, at least the ceiling is talking to us.
Good, so Anna Wilk.
Good morning.
Good morning.
Can you hear me?
Yes.
We can.
Yes. So, good morning to everyone. My name is Anna Wilk, and I work at Mitchell Cancer Institute. We are affiliated with University of South Alabama. I'm an instructor here at Mitchell Cancer Institute. My reason for joining the course is, of course, MCI joins research together with clinic, so it's perfect course for me. And I do some translational research, but not as much as I would like, so I hope to use the knowledge which I'm gonna get during this course to expand my research. And paper which I would like to publish, I work currently on CD73 receptor, and I have a lot of negative data, so I would love that somebody accept my long-term work. So thank you, and I'm glad to be here.
Well, thank you.
The next person is BettyKennedy from the Pennington Biomedical Research Center. If you can unmute. Okay. We're not hearing Dr. Kennedy, although you appear unmuted. Maybe we'll go on for a second, we can come back, or you could type in to the chat box your answers to the opportunity here. So the next is Grace Hoffman from Auburn University School of Pharmacy.
Hello.
Hi.
Good morning.
Good morning. I'm Grace Hoffman. I'm a second-year pharmacy student at Auburn University. I'm here joining Alzheimer's research with Dr. Amal Kadumi, who's also taking this class, and we're taking molecules targeting the blood-brain barrier in Alzheimer's disease from preclinical to clinical trials, and I'd also like to help publish a paper and present a poster regarding this topic.
Good, thank you.
Great, and Dr. Roper from Auburn University Kinesiology.
Good morning. My name is Jamie Roper, and like you just said, I'm an assistant professor at Auburn University. My academic discipline is in biomechanics, and I'm taking this course because I want to further myself as a researcher, and it's also going to help me hit my long-term research goals. I'm a take it one day at a time kind of person, and right now I've got a manuscript in that I really want to get published called Spatial Temporal Gait Parameters and Tremor Distribution in Patients with Essential Tremor.
Good, thank you very much.
Okay, I have a name listed as Kimberly Garza. I don't think that person is registered, so maybe you're borrowing a...
She's a mentor.
Okay, so this is a mentor. If you don't mind telling us your background, Dr. Garza?
Sure. Pardon me, I'm getting over a cold. I am an assistant professor at Auburn University, and I am Josh Hollingsworth's mentor. He hasn't introduced himself yet, but he will. My academic discipline is behavioral economics, and I'm joining this course to better mentor Josh. And the paper I'd like to publish is one I've been sitting on for a while on delayed discounting and dietary behaviors.
Great. Annie Kirby from Auburn Biomedical Affairs.
Hi, yes, I'm Annie Kirby, and I'm with the Edward Via College of Osteopathic Medicine here in Auburn, and I'm an assistant professor, and my academic discipline is in nutrition. And the reason I'm taking this course is just to take any opportunity to get a more robust foundation in some of this translational research and clinical research. And I guess the paper that I'd like to publish is really taking a lot of the evidence-based nutrition principles and being able to actually apply them in real-world settings. And so pushing research forward to be able to do that. And then I'm also here with Courtney Gemston and Josh Hollingsworth, so I'm going to let them introduce themselves.
Hi, I'm Courtney Gemston. I'm the discipline chair for pharmacology at the Edward Via College of Osteopathic Medicine. I am an ambulatory care pharmacist, and I joined the course to develop my skills and to improve my research program. The paper I'd love to publish is something along the lines of decreasing the burden of type 2 diabetes in the South by improving screening for identification of prediabetes and intervening with the diabetes prevention program. And my mentor, Dr. Kimberly Braxton Lloyd, is the Associate Dean for Pharmacy Health Services at Auburn University, and she's on the phone.
Terrific.
Hello, everyone. Josh Hollingsworth, you just all met my mentor, Kimberly Garza. I'm an assistant professor here at VCOM Auburn, Edward Via College of Osteopathic Medicine, teach pharmacology. I have a PharmD and a PhD in health outcomes research. So joining this course really to just better my skills as a researcher. And a paper that I'm interested in publishing would be say the ability to form and maintain healthy habits before and after completion of a 1-week Tiny Habits training program. So interested in forming and maintaining healthy habits related to diet, exercise, sleep, stress reduction, that type of thing.
Okay, I'm going to just take a moment. BettyKennedy, who we couldn't get the microphone to work, helps to be successful at getting grant funded for a large community-based participatory research model of caregiver interventions. Her paper she's passionate about, I believe, is already published for the foundational work completed with caregivers of heart failure patients. There's another person who is listed, this is Mike Gallahan at the Auburn School of Nursing, who is interested was actually the coordinator of the Simulation Center, assistant clinical professor, joining the course to develop more complete research techniques. Mentor is Dr. Rob Thomas, and would love to publish a paper on a sustainable intervention for back injury prevention among nursing professionals. Okay, next is Maninder Sandy.
Hello.
Yes, we hear you.
I'm Maninder Sandy. I am assistant professor in the Department of Pathobiology at Auburn University. I am also a veterinary anatomic pathologist. My area of research is oncolytic virotherapy for dog cancers. We are interested in like dog oral melanomas as well as osteosarcoma. And the paper, the why I joined this is because I wanted to have a formal translation research. And paper I would like to publish is I'm working on a gene with anti-tumor properties. So the gene name is canine MDA7. It's like melanoma differentiation associated gene 7. So I would like to publish a paper like canine MD7 is an excellent therapeutic for canine oral melanoma. And my mentor is also here with me. His name is Dr. Bruce F. Smith.
Good morning.
Good morning.
My name is Bruce Smith, and I'm a professor in the Department of Pathobiology. I'm the director of the Auburn University Research Initiative in Cancer, and I know Bob well because I'm also a player, a co-investigator on the CCTS grant. So welcome everyone to this program, and I'm glad you're all here. I'm here obviously as Meninder's mentor, and I work in the area of oncolytic viruses for cancer, and so the paper I'd like to publish is custom oncolytic viruses for individual patients.
Terrific. Okay. Mark Gillespie. Need you to unmute.
Yeah, good morning. I just stepped away from the computer. I'm Mark Gillespie. I work at the University of South Alabama College of Medicine, where I'm chair of pharmacology. I'm site lead for the CCTS partnership down here at South. I'm a pharmacologist by training. I do translational research in the area of oxidative DNA damage and transcriptional regulation in human disease. And I'm honored to work with Bill Billette, who's also on the line from Sarasota, where he's down there on family business. Good morning, Bill. And the paper I'd like to publish, gosh, I can't think of a paper that I didn't want to publish off the top of my head. So, good to see you, Bob and Dave.
Okay.
Thanks very much, Mark.
So maybe we'll go next to Dr. Billette.
Yes, good morning.
Good morning.
I'm Dr. William Billette. As you know, I'm working with Dr. Gillespie as my mentor. I'm an assistant professor of psychiatry at University of South Alabama, and I've joined the course to learn more about becoming a clinical researcher. We have an interest in investigating the role of oxidative brain injury in chronic mood disorders and how that might eventually lead to development of new treatments.
Great. Okay, Dr. Nathan Pinner.
Yes, I'm Nathan Pinner. I'm with Auburn University Harrison School of Pharmacy in the Pharmacy Practice Department. I'm a clinical associate professor, and I'm a practicing pharmacist. Part of the reason for joining the course was just having little formal training in research and being in the clinical realm, looking to improve the quality of the clinical research projects that I can do. And one that I'd be interested in publishing would be looking at ways that pharmacists can work at discharge of patients with COPD to match them with inhalers best suited for that patient.
Great. And Sharon Frew.
Hi, I'm a mentor to Kathleen McCoy, and I'm a professor at the University of South Alabama. And my area of the paper I'm working on is obesity prevention and wellness promotion with freshman nursing students.
Excellent. And Dr. Wei-Si Yang.
Hello. Yes. Can you hear me?
Yes.
Okay. Thank you. I'm from Mitchell Cancer Center at the University of South Alabama. I'm a radiation oncologist. I'm joining to try to initiate a phase 1 trial for one of the novel radiation technique called LADIS. And once that is available, I would love to publish papers for non-cancer patients that can benefit from this study.
And then we have one more just joined, Amal Kadumi. Need you to unmute, Dr. Kadumi.
Is that me?
I'm still there.
Okay, we may not be able to get Dr. Kadumi. And then Sarah Watts, who's Assistant Clinical Professor at Auburn University School of Nursing, trying to become more prepared to lead research efforts, wants to publish a paper related to creating safe, healthy environments for healthcare professionals. She's the mentor of Kathy Jo, or her mentor is Kathy Jo Ellison at Auburn. Okay, we'll move back to our local.
So before we start, I'm looking around the room and seeing who's taking notes on everything that's been said. And in case you haven't been, don't worry, the list of everyone who's in the course, is that me, David? Maybe that's the two of us. Should I back out of the room?
Join us online would work pretty well.
The list of everyone who's in the course, where they're from, what their primary affiliation is, their email address, and Jean, will we have phone numbers?
I don't have phone.
So we might develop phone numbers, and as you might imagine from this, and then we'll come back to the PCAMS library for further introductions, mindful of the time. When we think about this course, part of it is going to be what I would call structured skills. Part of it is then how do we work together in doing translational science. So if this is feeling a little bit different than a typical sort of didactic course, you're absolutely right. That's the intent. But we'll be circulating these names and you'll understand why in just a little bit. Anyway, please carry on.
Okay. Good morning. I'm Janine Lawrence. I am a mentor for Dr. Douglas, who's here today. And let's see, I am the Assistant Dean in the College of Human Environmental Sciences at the University of Alabama. I am the Department Chair for the Department of Human Nutrition and Hospitality Management. And my area is in clinical nutrition. And so the paper that I would love to publish would be, well, I'd like to try and explain why African American older adults with cognitive impairment, men don't seem to lose weight or muscle mass the further they become impaired, but women and Caucasians do. And I'd like to know exactly why. And a bit of trivia, I was the first nutrition fellow in the GCRC back in the day before the CCTS.
So welcome back.
It's going to be on.
This is the sequel to the GCRC, a somewhat different incarnation, but please go ahead.
Good morning, I'm Joy Douglas. I am an assistant professor at the University of Alabama in the Department of Nutrition, where I teach in the clinical nutrition aspect. My research is in older adults and dementia and feeding issues with dementia and maintaining nutritional status. And so Dr. Lawrence and I are working currently on publishing several papers that came out of my dissertation work, looking at why registered dietitians would follow evidence-based guidelines regarding feeding tube use in older adults with advanced dementia. I'm joining the course to strengthen my research skills and help me as I'm putting together a research trajectory moving forward.
Thank you.
Good morning. My name is Marky Sneed. I'm a PhD nursing student here at UAB. My interests are in being in this program are to kind of get more information on clinical translational research and be able to apply that in the future when I graduate. And a paper that I would be interested in publishing is looking at dietary quality and adherence in low sugar consumers with prediabetes or type 2 diabetes risk.
Hi everyone, Happy New Year. My name is Colleen and I am in my first year of the PhD program in the School of Nursing, and the reasons for joining this program is because I am a novice researcher and I wanted to take advantage of an opportunity to learn more about research in clinical and translational science. A paper that I would love to publish would be any paper, as it would be my first publication, but hopefully something pertaining to my topic, which is workplace violence or workplace bullying and the impact that it has on new graduate nurses and their mental health. But great to be here.
Thank you.
Hi, my name is Meredith Wood, and I'm in the Department of Surgical Oncology. I am the first breast surgery fellow at UAB. I joined this course to get more formalized training because I'd like to do research in my clinical career next year and this year during my fellowship. And I'm working on a paper on our high-risk prevention clinic for patients at risk for breast cancer.
Hey, I'm William Gilligan. I'm a neuroimmunology fellow, the Department of Neurology. My reason for joining this course, I'm going to be a new faculty member next year at University of South Alabama, so I'd like to have some formal introduction to clinical translational research outside of the, handful of hours in med school. The paper I'd like to publish, I'd like to look at the reasons that people get MS in the southern United States versus the rest of the United States. Formal cohort.
Andrew McDonald, Assistant Professor, Department of Radiation Oncology in the Institute for Cancer Outcomes and Survivorship. I graduated this course 3 years ago. Papers I'd like to publish would be, I'm in the camp that has 3 or 4 unpublished papers on their desktop that need to get done before we talk about more papers.
We look forward to all of them.
Good morning, I'm Spencer Kirkland. I am also in the Department of Radiation Oncology. I'm a resident in that department. Reasons for joining this course, I want to, as a more clinically oriented member of the course, it seems I'm interested in developing my skills as a researcher, but also my skills at interpreting research. I already saw there's a couple lectures on biostatistics, so I'll be listening to those closely. Paper I'd love to publish, similar to Andrew, is the one that's closest to being finished. That right now is a paper looking at outcomes and toxicity in patients treated with hypofractionated or high dose 3 to 5 fraction treatments for early stage lung cancer here at UAB.
Good, thank you. And just one quick note, in addition to presentations on biostatistics, I hope you're aware that we have weekly statistical clinics that happen here. Believe, Jean, the clinics are Wednesday noon. Typically there's some pizza or something like that out in the atrium. So, it just all depends on what you need. Go ahead.
Hi, my name is Jessica Corcoran. I'm a first-year PhD student in the School of Nursing. I was really interested in this program because, like Colleen said, we're first-year students, so we have a lot to learn. I'm really excited about learning about clinical and translational research in hopes that I can use that in my practice as a nurse practitioner and translate some evidence into practice in terms of as a researcher. I'd really like to publish papers on adolescent sexual health and their perceived ineffectiveness in sexual health education. So we'll see where that goes. I have a lot of reading to do, but I'm excited to get started.
Good, thank you.
Hi, I'm Gwen Childs. I'm an associate professor in the School of Nursing, and I'm Jessica's mentor. The paper I like to publish, I'm kind of with you, the ones that are on my desk that need to be finished. And that's where I am.
Thank you.
Good morning. I'm Karen Heaton from the School of Nursing. I'm an associate professor and the director of the PhD program. So I am here to support our 3 students, but I'm also here because I'm Colleen Anashovitz's mentor. One of the other things I do is direct the occupational health nursing program at the NIOSH funded Center for Education and Research that we have in consortium with Auburn University. There's so many papers that I need to be publishing, but one that I would really like to publish with Colleen has to do with whether or not there's new graduate nurses morningness versus eveningness and how they are assigned to their shifts and whether or not that contributes to depression and anxiety among new graduate nurses. So, happy to be here and thank you very much for supporting our program.
Thank you.
Hi, my name is Susan Meyer, and I'm an assistant professor in the Department of OBGYN, urogynecology, and the reason that I'm here is I'm working on my master's in public health, biostats, so this is part of my requirements. Other than that, and also this course I think will help me with my long-term career goal, which is to become a successful clinician scientist. Papers that I would like to publish would be several that I'm working on as to the impact of aging on pelvic floor symptoms and disorders such as incontinence and pelvic floor products.
Thank you.
Hi everybody, my name is Celia Voskovinik and I am a 4th year graduate student in the neuroscience team of the Graduate Biomedical Sciences program. and I am in the lab of Dr. Eric Roberson, my mentor, and I study Alzheimer's disease and specifically the role of tau reduction in excited inhibitory neurons, as well as the role of BIN1 reduction in interneurons in Alzheimer's disease. The reason I joined this course is to develop more clinical understanding of Alzheimer's disease, since everything I see on a daily basis is the lab environment. And the paper I would like to publish is the two papers that I'm working on right now. And the first one is on the tau reduction, and the second one is the role of BIN1 reduction in inhibitory neurons.
Thank you.
My name is Eric Roberson. I am an associate professor of neurology here at UAB. I direct the Alzheimer's Disease Center and the Center for Neurodegeneration and Experimental Therapeutics. I'm here as Julia's mentor, and those are the same two papers that I would really like to see.
Sounds like we have a plan.
Hi, I'm Jamie A. I am a third-year pediatric hematology oncology fellow. I'll be staying on next year as an assistant professor, taking the course to help me learn more about clinical trial development, and I'd love to publish something someday involving a cure for pediatric sarcomas.
Super, thank you.
Hi, my name is Marissa D. I'm a second-year movement disorders fellow in the Department of Neurology here at UAB. I joined this course because the residency I didn't get much training in clinical research, and I'd like to use this course to help advance my career so that I can perform clinical research as I stay on as faculty next year. Paper that I love to publish, I'm really interested in looking at the African American population in regards to Parkinson's disease, and if their presentation and clinical course is different. So a lot of our research currently has only been done in mainly the Caucasian population.
Thank you.
Good morning. My name is Ashlyn Everett. I'm a resident in the Department of Radiation Oncology. And I think this course is going to be really valuable in helping as a clinician to understand and to also participate in design research as I move forward in my career. And a paper that I'd love to publish is related to individualization of radiation therapy for our patients.
Thanks.
Hello, my name is Elizabeth Osbeck. I am a fellow in the Department of OBGYN, the Division of Maternal Fetal Medicine. I joined this course because certainly clinical research will be an important part of my fellowship, but also my career going forward. So I'd like to improve my clinical research skills. In terms of a paper I'd like to publish, Dr. Alan Tita is my research mentor. He was here and unfortunately had to leave for another meeting. He and I are in the early stages of designing a clinical trial looking at methods of induction of labor in the outpatient setting. So looking forward to completing that trial and getting that published.
Thanks very much.
My mentor is on the phone, but apparently is not showing up, and she sent an email. Her name is Dr. Jennifer Langreason Rolling. We call her LR. And she's a professor of psychology at the University of South Alabama. She's also an executive director of the Gulf Coast Behavioral Health and Resiliency Center, which is funded by the BP oil spill.
Good. Thank you very much.
Hi, I'm Claudette Paul. I'm a fellow of pediatric infectious diseases. I'm in my third year. I'll be staying on as faculty. I'm pursuing my master's in public health, and I'm interested in the prevention of respiratory viruses in vulnerable patient populations.
Thanks.
Good morning. My name is Ek-J Lee, and I'm an assistant professor in the Department of Neurology, and I specialize in neuromuscular medicine. I'm interested in myasthenia gravis, and I'd like to do my research in the future focusing on the biomarker. So the paper I'd like to publish in the future will be something like correlating antibody and complement activation correlating with the disease severity. And we are planning on a pilot study that I would love to lead that to some grant-supported large-scale study. And I think this course will be definitely helpful.
Thanks very much.
Good morning, I'm Beatrice H. I'm an assistant professor in the Division of Rheumatology here at UAB. So I'm taking my MSPH program, so this is a requirement. But in addition to that, I do translational research looking at the impact of insulin resistance on physical functioning in patients with rheumatoid arthritis. I'm still in the recruitment phase. It's really challenging, so I hope to complete recruitment and do the data analysis and publish the papers related to this work.
Beatrice, thanks so much.
Okay, I hope we didn't leave anybody off from the people joining us by GoToMeeting. It's one last chance to speak up if you unmute yourself and shout out. Okay, I think we... Oh, go ahead.
Hello?
Yes?
Yes. Hi, my name is Amal Qadoumi. I am from Auburn University at Harrison School of Pharmacy. I am a professor in the Department of Drug Discovery and Development, and I joined actually recently in August the university. My research area is more related to finding drugs against Alzheimer's disease. And we established a high throughput screening assay that identified actually multiple compounds and drugs for the repurposing approach. And we published many papers about that, and we are looking to hopefully that at one point we move forward with one of these drugs toward the clinical studies, and that's why I am here. Thank you very much.
Excellent, thank you.
So we took a fair amount of time, but I hope one thing that we all recognize after the introductions is the incredible diversity of the group that we have here. Diversity in stage of professional career arc, but also diversity of experiences. The one word I heard often is wanting to do translation. Of course, that begs the question, what do we mean by that? But before we get to that, which for those of you who saw me peek at the next slide to see what David did to that deck, there's another point I'd like to make. As I was listening to what people wanted to learn, whoops, I think I really am not supposed to go there, David. But what our project aspirations were, I heard two kinds of things. One was wanting to learn what I will call transactional skills. How do I do biostatistical analysis? Really important. How do I design a study? I think there's something else that we hope will come through this course, and that's another T skill, and that's called translational thinking. I do think translational thinking is a little bit different than project-oriented thinking, and I'll try to see if we can't begin to set the landscape for pursuing this as one thread throughout the next couple of months, actually, in the course. But first, some definitions. What is translational science? Well, where do you go to find out? Lots of different places. So I went to the dictionary. You guys can read this as well as I can read it, but Webster says, what? It's medical research facilitating practical application of scientific discoveries. Implicit in that statement is moving discovery to delivery in some way. And that's a very practical orientation of that. If you go to the OED, you get a similar kind of concept. They like the word conversion from one form to another form, but the idea of movement is still there. I don't know whether that captures for you the definition of translational thinking. So I decided to go to the NCATS website. Does everyone know what when I say NCATS, what that means? Okay, so that's the National Center for Advancing Translational Science. And it's much easier to say NCATS than it is to say the National Center for Advancing Translational Science. It's one of the NIH institutes. And in case you want the sort of practical implication of that, they are our sponsors. They're the NIH institute that supports the CTSA program and the CCTS here within our region, both hub and our partners across the network. So what does the NCATS have to say is the definition? Thank you. They are not particularly pithy. in their definition, but as I look through this, I still see the same kind of concept. It talks about moving across different stages, discovery at different stages, perhaps of magnification, different kinds of questions, and from NCAT's perspective, eventually demonstrating usefulness and disseminating those findings, and realizing that that's important for everyone. So, a couple of different ways of framing this. One is going from bench to bedside to populations and communities. And that's basic biomedical research. Going to clinical research, sometimes that's called a T1 transition. And from clinical research to improved health. Sometimes people call that a T2 transition, but you've probably heard that T language used in a number of different ways. There are other ways of representing the translational spectrum as well. This is a similar kind of diagram for the development of new compounds, and some of you talked about developing new treatments. Can you guess where this comes from? And actually, this doesn't get the whole thing. That's the bottom half of the graph. I couldn't shrink it enough to get on alone. So that actually comes from the NIH. They tend to think in a little bit less pithy way than the dictionary does. But as you look in this, there are two critical points that I'd like to make that I think this graph does illustrate. First of all, you'll notice a lot of arrows, and explicit in the arrows is movement from one kind of question to another kind of question. That's actually the Latin root of the word translation. But the other is, if you can see it on the screen, this rather complicated map is grouped into buckets with different colors. And what that's not only suggesting, I think it's denoting that there are different kinds of questions, different skill sets that are needed to move from initial discovery all the way eventually to what is the medical landscape and practical application. Now, I realize that the concept of translational science is just moving things along is rather broad, but in fact, that is the nature of the kinds of things we will be exploring over the next couple of months, because sometimes we'll be in a very more fundamental space, talking about molecules and variants, and the idea now, a lot of discussion about what's the application of genomics to clinical phenotype. We may also, at the other end of the spectrum, be talking about implementation science and what that means and what you need to know and what kinds of skills are important for that. I'd like to ask, and we won't go through everyone again, but ask for some volunteers, both volunteers in the room, but also volunteers online, to just comment on role models you may have in your own mind for translational investigators. Anyone brave enough in the room to raise their hand or stand up to talk about a role model they have in mind for a translational investigator? Oh, there must be someone. I've noticed that a couple of the mentors were kind enough to be here, but then they're going on to other meetings. So for those of you where your mentors have left, this is the opportunity to say whatever you want. Go ahead.
So I suppose one of the role models I have is Richard Whitley. He was the founder of the Collaborative Antiviral Study Group, and they basically, laid the foundation for collaborative efforts to come up with safe and effective treatments for very rare conditions. And I think they really have established the model for very many other conditions of how you can go about, solving complicated problems.
So could I ask just a little bit You talked about the questions that Rich asked. How did they approach those questions? Do you have a sense of what helped him to succeed? What his approach was and any roadblocks he encountered?
I suppose one of the things that helped him succeed was he was brave, he was bold, and he collaborated. So rather than trying to solve the problem on their own, which would have been impossible to get the numbers, they collaborated with a lot of different institutions. I think a roadblock would be just that it's very, very difficult to do. When you're trying to solve really hard problems, it's hard to do, and it takes a long time. So where we are now is about 50 years worth of work.
So can I recast that into a question? Was the question the direction he was pursuing? Was it all defined at the very beginning, or was he defining an important pathway of research or direction of research? I'm trying to lead you to an answer.
I would say it was the pathway.
Anyone else? Thank you very much. That's very helpful. Anyone else willing to? Please go ahead, David, to your right.
My role model was absolutely my mentor, Dr. Eric Roberson, and he already left, so I can talk about him. And the question that he asked was the function of the protein tau in Alzheimer's disease. And as a postdoc, he was able to show that the removal of tau in a preclinical model, in a mouse model of Alzheimer's disease, is absolutely protective from all of the Alzheimer's disease phenotypes, which was absolutely baffling at that point because nobody believed the fact that removal of tau can lead to such an effect. Now it led to a huge number of studies that has been done on the topic, including the start of a clinical trial this year with patients being treated with the antisense oligonucleotides against tau at the various stages of Alzheimer's disease in the UCSF study. I think the opportunities that it gave him is to establish a new area of Alzheimer's disease research, studying more so the role of tau than the role of A-beta in Alzheimer's disease, and the fact that removing the neurofibrillary tangles way before that they are able to form is a huge therapeutic opportunity. And what helped him to succeed is probably just believing in all the science that he was doing and believing that the results that he was seeing were real and pursuing the evidence and hypothesis-based research.
So as I realize this work is in progress, but as together you have made progress on this pathway, what's helped? What's been important?
I believe on the research side is tenacity and never giving up on just going and asking the questions with different methods and just believing in what you're seeing and believing in your results and being able to change your mind when you see your results and not being married to your hypothesis when it doesn't work.
So would it be fair to say there are probably a couple of comments or principles embedded in your remarks? One is you're driven by the data, by the facts, and you're willing to change the hypothesis. Could I ask, at the very beginning, were antisense oligos, had they been developed?
So they've been developed to target tau for the patients. I believe that the safety study has been already completed. It has been, multiple studies have been done in the mouse models and rodent models of Alzheimer's disease.
So can I lead you a little bit more? At the very beginning, when Dr. Roberson articulated that he wanted to work in this area, were antisense oligos part of the toolbox?
No, absolutely not.
So what happened? There was some innovation in technology.
Yep.
Is that fair?
Yeah.
Okay. Anyone else? Anyone online? Come on, guys. This is a chance for you to make comments. Say whatever you'd like. Unmute, jump in, send a chat. If nothing, it's going to be my turn.
Anna Wilk.
Oh, please. Go ahead. Thank you.
You're welcome. I would like to mention one incredible clinician, Dr. Frank Kulikia, who for me is a model for translational research. So he's a chief on neurosurgery, and this is a person who every researcher would dream to have on his team, because he is a very, very busy chief of neurosurgery. He took a phone when I was working still at LSU, when they had a patient, and during surgery he was telling us, "Come guys, there is a sample, you can take it and you can use in your research." So he works on glioblastoma, and we all know that this is a very deadly disease and there is not much what clinicians can do it. And he was so dedicated that he really put a lot of effort in our research. So I would really highlight this type of person.
Thank you very much. So I think part of what you've talked about is you've reinforced concepts of commitment and tenacity, which we talked about a little bit before, and also the importance of observation, because we all are observing in different venues. Sometimes it might be a venue defined by clinical practice. Sometimes that venue might be defined by the laboratory. Sometimes that venue might be out in populations. Is that fair?
Yeah, definitely.
Good.
Definitely.
Anyone else? Thank you. All right. So, my turn. I'm going to start a little bit differently. And this list is, as it was a couple of days ago, was constructed before any of this discussion. And what I'd like you to do is to see whether the list that I made, and it's actually drawn from an author, has anything to do with the comments you guys made. So what are the characteristics of a successful translational investigator? Okay, one is creativity, and I think we heard a little bit about that. The ability to both imagine solutions, the question, the solutions, and then to bring that together with the base of knowledge that we have at any particular time. I heard using slightly different words, perhaps the word here had to do with, understanding the problem, but a curiosity about what's causing a particular phenomenon, a particular phenotype, whatever it might be. So both the creativity to think outside the box, but also the curiosity to want to think outside the box. A span of multiple disciplines. You each mentioned that in several different ways, but you'll probably notice that in the three examples that you offered, they're each representing a different discipline. And each of them, as they have tried to work on the problems they've chosen, have drawn on insights from multiple disciplines. Multiple times I heard the word observe and respect the facts, be data-driven, be willing to change your hypothesis or your direction based on what you learn along the way. The word collaborate came up spontaneously. I think that was with your comments about Rich Whitley initially, where it really, for large questions, typically it is not amenable to developing answers if one thinks solely in a silo. We need to think a little bit more broadly than that. And that involves not only multiple disciplines, but involves not just willing, but proactive collaboration. Here's one nobody mentioned, but I picked this out of the chapter because it's my favorite, because it sort of, it resonated to some of the habits that I have in terms of making lists, getting distracted, and procrastinating. Now, I don't think the author here was talking about, don't write your paper start writing your paper until the very last minute. Don't wait in putting together your grant until 2 hours before the deadline. But here in the context, which you can't tell from this list, what the author of this particular chapter was referring to is be willing to give a little bit of time to let ideas marinate, strategies to develop, and always be working iteratively on perfecting that framework, that model. So a little bit of procrastination, there's a better word than that, but I procrastinate, so I like it. But that may help. It's a little bit of leavening on the whole process, because that connection of curiosity and intellect doesn't happen automatically. It's not something you can order up. It's something that happens through discussion and iterative analysis of the problem. Now, does anyone recognize this list, who that might be describing? There are lots of people. Anyone know who Walter Isaacson is? He's an author. Does that help? Okay, so this is, I was hoping someone has been watching the Times Book Review, or you've been on Amazon looking for things like this. These characteristics are actually chosen from a chapter on a particular translational investigator after writing about a 500-page bibliography. Walter Isaacson was the author. If you want, the book is for sale on Amazon. I will give you a disclosure. I have nothing to do with Amazon and don't use it. But it's important to know who this is, because translational investigation is not something that's brand new. Before I tell you who this is, did you have a question?
How do you spell his last name, the author's last name?
Isaac, A-S...
I-S.
I-S, I'm sorry. I-S-A-A-C-S-O-N. First name is Walter.
A-A-C-S-O-N, yeah.
Didn't I say that?
He wrote the biography of Steve Jobs that got a lot of splash a while ago, but he's a great...
But this is not who he's describing. Anyone recognize that guy? It's Leonardo da Vinci. Leonardo was probably one of the most creative translational investigators that all of us had been privileged to learn from. His books, his notebooks, the way he thought. Sometimes people use the word polymath to describe him, but I think perhaps the most important thing is Leonardo thought very broadly. And because he thought very broadly, starting with observation, clearly being driven by what he saw and to the best of his knowledge what the facts were at that time, he had a number of creations. Usually we think of him as an artist, and obviously he was. I'm sure you know some of the paintings that are attributed to him. One is called the Mona Lisa. Another one, a portrait that is attributed to him, there's some debate, but was just sold at Sotheby's for $4.5 million, was another portrait from the time of Mona Lisa. But he also developed models for airplanes, for how to move water across and aqueducts and things like that. An extremely creative translational thinker. And here are the characteristics that after the study of his life, Isaacson came up with. And you've already mentioned some of those with some people who have affected all of us individually. Okay, so what I'd like to do is then go to suggest a somewhat different metaphor of translational investigation in life science. Does anyone know what I would be talking about if I mentioned the word taproot? There must be some horticulturalists amongst us. Taproot. It's a carrot, but a carrot has a big taproot. And what I would suggest is that when we think of things as a taproot, it's taking something and going perhaps in a very almost straight line, but thinking very deeply about it. We might think about that as disciplinary science, where we're trying to make sure, in whatever our chosen discipline is, that we have a deep and strong background in that. But I'd like to suggest that the disciplinary science is a little bit different, and disciplinary thinking is a little bit different from translational thinking. So does anyone recognize that kind of root structure? So when you go online, this is sometimes called the fibrous root structure. But the idea here is that rather than having a single, very focused, direct taproot, it spreads out and draws, if you're a plant, it draws its water and its nutrition rather more broadly. But it's also, I'd like to introduce the concept of working laterally. And so what might we be looking for in translational science? It's a combination of both the taproot, which you can think of as that main root going down in the right-hand illustration, but also having that lateral spread. So it's both the deep and directed disciplinary thinking, but it combines that with a lateral thinking, and together creates perhaps even the most robust root structure for growth of our scientific projects. Now, if you like to look for parallels in structure, that sort of looks like a T, doesn't it? And that's probably why we call it translational science. And if you buy that, we can sell most anything during this course. But what I would like to suggest is actually thinking both in a focused, disciplinary way. It's critical, because if you only have that lateral but shallow root system, you're actually fairly easy to uproot. But when your research programs have both that deep disciplinary thinking and that lateral thinking and bringing in the ideas, then you actually have the strongest root system of all. And when you look at the most successful research programs, no matter whether you're in fundamental science, you're in clinical science, you're in population science, it's those programs that have developed both that capacity for the deep disciplinary thought in the context of that larger and lateral context. Okay. So some examples of translational science. We've already heard some. I'd like to give you a couple, and these were put in here just to make sure that we're all thinking in a similar way. If we're in engineering, it's actually pretty easy because engineering is very applied typically, and there's been a focus on translation of engineering discovery into application for quite some time. So the two I chose over the last couple of weeks are things that translate into current innovations, material science. That fundamental investigation, maybe the parallel is to basic biomedical science, translating into Boeing's 787 Dreamliner. Does anyone know why I chose that? What's behind that? Oh, come on, guys. Let me start differently. Has anyone ever heard of the 787 Dreamliner? So we have an opportunity for broadening what we read about and what we think about, because actually sometimes from models that might be in engineering can help inform the way we might want to think about our life science and our medical science challenges. So to decode the Dreamliner, the Dreamliner is the first plane made that uses carbon fiber composites for its wing. And why did they do that? Because it's much lighter, and if you can figure out how to fashion this stuff, the end product is much stronger. So what the Dreamliner is anticipating is the need to be more eco-friendly, to burn less jet fuel, and that anticipates, of course, at some point in the future, a restriction on petroleum products, whether that's a regulatory restriction or the fact that we actually run out of the stuff. A beautiful example of innovation coming, translating from very fundamental material science and engineering all the way through to practical application. Something I hope is a little more obvious is chip fabrication. And for those of you, some of you must watch television. Have you ever seen an ad for the iPhone X? Anyone? Of course you have. And what's in the ad, in the television ad? What's the image in the television ad? Has anyone seen the ad?
Your face.
Well, that's one thing. The face is there. Is there anything else that's in the iPhone X ad? Do you watch the swirl of colors? Yeah, at least one person. I guess I watch more television than you guys. I'm so glad that you're so applied on being very serious. But this happens even in the nightly news. But what they're demonstrating is the fact that the iPhone X has a compute power that surpasses anything else that's been available, at least for mobile technology up till now. And that's based on fundamental work in materials science, in chip fabrication. Then, of course, whoever manufactures, is probably Intel, manufactures now the A11X chip that drives iPhone X. Actually, if you really have been watching the ad, you know I'm misspeaking. It is typed as iPhone X, but we are supposed to say iPhone 10, not iPhone X. It is the iPhone 10. 9 got skipped somewhere. Any examples of similar kinds of translation in life science? Anyone want to offer some that come to mind? And this is an opportunity both for people in the room or people coming in online. Anyone have some ideas? Just one example. Have we done any translation in biomedical science over the last 10 years? Yes, thank you. Bail me out, because all of these examples are drawn actually from advertisements on broadcast TV.
In the pharmacology world, I'd say looking at drivers for mutations that cause cancer, and then we've developed pharmacologic targeted agents towards those. I would say that's a very good example of translational science.
Right, so that's using the combination of genetics and genomics, being able to understand at a very fundamental level what the biologic driver for cancer might be, and then developing agents to target it. Seriously, does anyone watch the nightly news? Gotta watch that. Nobody watches the news? My gosh. Is that because everyone's streaming Netflix, or is, yeah? Okay, so if you watch the nightly news, you will see ads more than you'd like to see for two concepts. One are people with inflammatory arthritis who now have a biologic that they can take that basically, I don't use the cure word, but completely control their disease. So it's taking some fundamental discovery about the biology of the immune system, understanding or at least hypothesizing that if that particular mechanism, this cytokine, were blocked, maybe all the inflammatory mediated damage of joints could be abrogated. And it's actually true, sort of. And that, well, you guys can figure that out. That's TNF blockade. So again, go watch the nightly news tonight, and I will wager you'll see an ad for one of the compounds that does this. There's one in particular that we have in mind. There's also ads for checkpoint inhibitors. Checkpoint inhibitors are used in oncology. They're a little bit different than the genotype-phenotype example you were given. but there are several agents out now which represent fundamental biologic knowledge in the regulation of host defense, targeting that through a number of biologic agents, now leading to new therapeutics, which actually create, have the capacity for a beneficial impact that simply was not there before. Two very obvious translational successes, where it's up there for everybody to see on TV if you watch the nightly news. Okay, so a couple of examples. One thing I'd like to do as part of this course is not only to have the sessions where we're talking about the particular study design, analytics, things like that, all of which are very important, but to get us thinking about, okay, working from the model, the direction that Rich Whitley took, working from the model that Eric took, recognizing here's a big problem, how can we think about it? Can we bring our translational thinking to meld with our transactional skills to solve a problem? If we were to think about that in terms of the region that we serve, so our 3-state region, would anyone like to suggest some translational challenges that we might be thinking about as a group over the next couple of months? This is not a deep and technical question. If you had to say, someone comes up, let's imagine we're at a cocktail party. Someone comes up and says, hi. Yeah, so, okay. It's saying, stay back, stay back. Imagine you're at a cocktail party and someone says, and maybe you guys were a couple of days ago, and someone says, hey, what are the most pressing health issues that are facing our region, our town, our state, frankly, our country right now? What would you choose? What would you say?
Physical inactivity.
Okay.
I would say obesity.
Okay, and those two might be linked, yeah.
Metabolic disorders.
Okay, so, okay, I'm hearing some interconnected concepts here. Anything else?
Cancer.
Okay, cancer might disproportionately affect our region, certainly cardiometabolic diseases, which is one facet of obesity, and obesity is related to lack of, in part, perhaps to less physical activity than would be appropriate, or at least what our biologic systems are accustomed to. Anything else? Aging.
I would say poor mental health.
Okay.
Neurodegenerative disorders.
Okay. This is going to be good because you. Now, anything else? There's a pharmacologist in the room. There are pharmacologists online. Anything in that realm that might be considered a health crisis right now?
Bacterial infection.
Excuse me?
Bacterial infections like antibiotics not working and resistant.
So, resistant bacteria? Opioids. What's the issue with opioids? So, opioids, the concept of addiction. Any other consequences aside from addiction?
Comorbidities. Older adults on multiple medications.
Okay. So there are a number of challenges for us. Can I come back to opioids and ask a question? Does anyone know how many people last year, calendar 17, died from an opioid overdose?
About 63,000.
Exactly. Some of the other challenges that are out there, do you know how many people have died from those?
Gun violence.
What?
Gun violence.
Gun violence, but you know, when you add up the numbers and you just say we should be driven by the numbers, actually the opioid crisis trumps just about everything else. And to say that it is well, we'll just leave it at that because you'll see where this is going. Anything else? Okay, I'm going to add one more, and then you'll see the fourth bullet left room for all the other suggestions that we've had and which we have noted. But one translational challenge is the opioid crisis. Well, it's just huge, and it's hard to imagine that we as a nation are not paying attention to this, given the fact that 63,000 people died from overdoses last year in the opioid crisis. You guys mentioned it: cardiometabolic, obesity, non-alcoholic fatty liver disease, NASH. Does anyone know what the major cause of cirrhosis of the liver is? Historically? I'm sorry. Alcohol has been number one. You know what's about to become number one? NASH, obesity. The consequences, another aspect of cardiometabolic disease. This is a crisis waiting to happen. It's not going to wait. It's going to happen if we don't do something about it. I'd like to add stroke. For those of you who may not know, we in the region are in what's sometimes called the stroke belt. This is not considered a great accomplishment or a great characteristic. This is really a major challenge for all of us, especially in our three-state region. We're sort of the epicenter of that. And then, of course, the other suggestions that you've already made. So, what are we going to do? I'd like to have us think about, as we are going through the sessions over the next couple of months, which are going to give us those transactional skills, to be thinking about how should we think about addressing some of these issues. Fair enough? Is that okay? For those who are online, either protest loudly right now. We've got everyone in the room here nodding in assent. I haven't heard any negatives, seen any negatives yet. So are we all on board? Okay, thank you. So what we'd like to do, we may have to change the numbers a little bit, but we'd like to take everyone, both those who are here in the room at the hub and those who are coming in online. Remember, we're almost equal numbers in the two groups, but to get together in some teams. And together as teams to develop or choose a translational challenge. You've heard lots of suggestions already, some of which we have articulated on the slide: obesity and things related to obesity, opioids, stroke, but we've heard many others. Maybe it's the emergence of bacterial resistance. It might be a challenge of how to take genomics and bring it to precision medicine. But I'd like each group to choose a translational challenge. Okay? Does that seem reasonable? This is something that can be done probably pretty easily online, through email. You have met everybody in the course, and of course we're going to give you the names and the emails, and you should have that in the handouts. And for those coming in virtually, you'll get these as attachments this morning. Is that correct? Thank you, Jean. So everybody is included, and then together as a team, come together and choose your translational challenge and develop a consensus statement. This does not have to be 3 pages. In fact, it could be 2 sentences, but why it is important. And again, this is not a deep technical quiz. You've already said why these things are important, but I think to help articulate where we want to go in each of the challenges, it's very helpful to know why we're doing it, Just to give you an example, the statement of importance for the opioid crisis. In 2017, 63,000 people died of an opioid overdose. This is untenable and we must figure out solutions. Probably you could word it a little bit more fluently than that, but that's the concept, just so we're all on the same page. Then, so that's the team exercise. But I'm looking around the room and I'm seeing some of you just in sort of the way you're sitting and nodding. Some of you saying, gee, I'd like to do that. And some others are saying, I'm not quite so sure that I'm happy about having to do this. Intrinsic in translational science was the word collaborate. Okay? If we want to do translational science, we've got to begin to figure out how to work together as teams. So this is one of the team exercises. But a lot of us actually have, and certainly I have, been trained to think in a little bit more focused way. So there's another opportunity for us. And that's the solo. And I would point out it's spelled S-O-L-O, not S-I-L-O, okay? And this is, you may find for your own background that the consensus of the team, the consensus challenge for the team that you're on could be perfectly valid, but there's something else that also really grabs your imagination and your energy. That's fine. How about two of those? And so if, two research questions that you would like to answer. Gosh, we heard so many in terms of the papers that you'd like to publish. So why not have each of us write down and send to Dr. Chaplin the two favorite kinds of questions that you would like to answer, and a statement about why it is important, and a statement about how you think you would begin to get the answer to that question. Okay? And this is not a 3-page treatise. If you write more than about a half a page, I'm not sure it's going to be read. So I would encourage you to think succinctly. But this is a chance for each of us to express not only how we're going to work together on the consensus challenge for your particular group, and each group can come up with something different, but also how to express our interest in individual questions that you'd like to answer. Okay? So there's a date on this slide. Everyone comfortable with that date? It's next week. Is that Monday? Monday next week? So, this is the kind of thing, I don't know how you guys work. I tend to work sipping a cup of coffee, at least in the morning. In the afternoon, it probably shifts to tea or something like that. But this is sit down, think about it, maybe write yourself a couple of bullets. Do what Leonardo did, and actually Walter Isaacson said this specifically about Leonardo. Procrastinate for a day. Think about it. Let the ideas marinate. 24 hours later, whatever it is, after you've slept on it, pop it into an email and send it to David. Not hard. But this is the way we can begin together to think about some of the major translational challenges that are facing all of us as we learn how we can actually do that research. Now, sometimes people talk about conceptual frameworks, and this could be both for the group consensus or for your individual questions. A conceptual framework can be helpful because it specifies the context, the focus, the potential application. It can help if you're a visual person. It can help articulate the frame of what you want to do. That's why it's suggested, or this suggests, a 1-page picture of that conceptual framework. By the way, for those of you who at least go to the library to look for the Leonardo book, you'll find this is the way Leonardo worked. He always put things in sketches, and his sketch notebooks are really fascinating to learn from, to watch how he was beginning to conceptualize his approach to problems. Has everyone in the room done a conceptual framework for projects that they've done? I see split vote. So can I make a couple of suggestions? Starting from the simplest to perhaps a little more complex, and you can figure out what works for you. So a simple conceptual framework or theoretical framework is given by this particular illustration. Academic achievement has two major components, or two major factors that influence academic achievement. One is academic ability. We have to figure out how to measure that, I guess, but let's not worry about that. And the other might be SES. Okay, your framework is those are the two key things, and the arrow says you put those together and get academic achievement. You know, that's pretty simple. We can debate whether it's helpful or not, but that's part of the value of a conceptual framework, because it puts on paper what you're thinking, and then we can look at it together and say, does this make sense? Does this help? Actually, you can do this no matter where you are, whether you're doing disciplinary science or you're doing translational science. So I hope for those of you who haven't done this before, you may find this is more generalizably useful. Okay, here's a different conceptual framework. It's ironic somehow. Whoever Joel Light is, he decided he was going to copyright this. Obviously, this came off the internet. But I put it up here just to say, well, Joel seemed to think he wanted more boxes in his conceptual framework. And, you know, if that resonates to you and in what you're going to do on your questions and your consensus, that's fine. There's no automatic it must be this or it must not be that. It's what works and helps frame the question. If we were doing a conceptual framework for drug development and NCATs, we were to ask NCATs what their framework would look like. Do you have any idea what that would be? We saw it earlier this morning. Okay. That helps. You know, for those of you, and this is, I think, the last slide or the second to last slide, you may or may not know that my background is in immunology, and we used to draw these conceptual frameworks for cytokine interactions, and it quickly became, it was crazy. Because arrows were going every which way, and what that really said is those of us who are thinking in an absolutely reductionist way, we're missing the point. It works as a system, and we need to think differently. Maybe that's what this is saying too, but those cytokine graphs are simple compared to this. So whatever works, couple of examples, whatever helps you think through your problem, that's what we'd like to see. So, we talked about next week already. We can certainly explore any of the issues we've talked about this morning. David, I think there's opportunity now for the rest of the time in the second hour to talk about some of the mechanics of what we'll be doing over the next couple of months. Okay, questions? If not, David?
Thanks. If we can just pass these around. So people need to take a 2-minute break. We have time for that, but we're running a little close to the wire here. So thanks. I think they're ready for the answers.
You might want to just comment about what's being distributed, David, so folks online know what's...
Yep. Okay, so I've passed out 3 different things, and they'll all be emailed. I'm totally incapable of keeping up with paper, so I'm passing them out so you can have them to look at now, but we'll email them later today. So the first one is the list dividing you up into work groups. There are, I think, 5 groups of 7 people and 1 group of 8. So this is your group to do your thinking about the translational challenge. Unfortunately, I didn't realize that my photocopier wouldn't copy the light blue color of the email addresses very effectively. So when you get the email, it will show everybody's email address more effectively. You'll notice that each group has 2 people who have an asterisk. If you have the asterisk, you're lucky. You get to be the co-leader of the group. I've just assigned this. If any of you totally reject this opportunity, let me know. I will only moderately lose respect for you, but it's an opportunity to help your group coordinate. And one of the goals of this project is for you to see that working together in a group is a challenge, particularly if it's a group that has multiple different kinds of interests. It's an opportunity, though, to really bring different perspectives and ideas together. So we hope this will be a sort of a chance for you to see what some of the challenges are, maybe to learn some tricks about how to communicate effectively with people you don't really know yet, and to begin to bring ideas together. So make contact with your group. Now, Dr. Kimberly gave you a bit of a schedule for the solo opportunity, which is to send me your ideas of the concepts you are really interested in developing for yourself by next Monday. I'm going to sort of try to pull those together into some general themes, and we'll talk about it some at the class next week. That's a pretty densely filled class, so we won't be able to carve out too much time for that, but we'll get a little bit started. We recognize that the really working together in a group to generate new ideas is more challenging and takes more time. So for that activity, again, I would like you to all have made contact with each other. So I would recommend that when you get the list of people in your group, which you'll get later today, send out an email to everyone in the group. You might want to give them your cell phone number or your office number, so that if it works out to be better to talk at some point rather than to try to communicate by email, you can do that. And then by next Monday, I hope you will have decided amongst yourselves what issue you want to what challenge you want to take on to write about. There's some really brief description of the kind of report we'd like you to have. Really, less than 100 words is the goal of the reports. And 2 weeks from now, we'll have about half an hour to talk about the different challenge issues you identified. And I will get information from you a few days ahead of time and try to bring together groups that are addressing the same challenge, so that we maybe only end up with 3 or 4 presentations. And it's up to the co-leaders to decide who in the group is going to give the presentation. It'll be very brief, so you'll work together, and I'll be sending a little bit more information about that. Okay, so there's the instruction sheet, which the online people, you'll get this by email too shortly. And then I've just also handed out copies of the slides for the last few minutes that I'm going to talk about a little bit of the mechanics of the course. And I want to spend a couple of minutes talking about the relationship that you and your mentors will have, and to encourage you to really be intentional about developing that relationship in a formal way. So what you should see here is how to contact me. So you can call me or send me an email. I'm happy to help with any logistical issues that come up about the course. You can stop by my office. I'm in the Shelby building if you're here in Birmingham. I also put Jean Lambert's contact information. Jean is really the person who makes this course run, and so don't hesitate to contact her if you have any questions, so please use us both as resources. I mentioned before Dr. Kimberly arrived, but I think not everyone was online, that one of the ways in which we make keep track of who's attending is, if you're online, for you to put your email address in as you register for your GoToMeeting session. And if you can't figure out how to do that, please contact Jean and she'll send you instructions for how to do it. I actually haven't logged in myself really recently to know exactly how you do that. So I want to talk just a little bit about the mechanics of the course. So the course is broken down into modules that are first set, which starts next week, will address issues around clinical trials. We'll have then a switch to discussions of ethical issues around human-based research that will cover a large range of topics, ranging from some of the history of why we have IRBs, for example, all the way up to modern challenges that we have in dealing with large, diverse populations for things like genomic-based research studies. So we'll talk about a lot of different issues in that. Then we'll have a section on epidemiology and biostatistics. This is really nuts and bolts stuff. An introduction, you're not going to be experts by the time you finish, but you'll at least know what many of the terms are all about. And really, one of the main things that you'll get from this series of modules is an awareness of experts around the campus and around our partner network who you can use as resources to get more detailed information about topics that are really relevant to the specific kind of research you're doing. We'll have a section on research project development. This is not exactly going to end up with a how to write your own grant, but it'll have elements of stuff to help you be ready to do that. We'll talk about some of the other resources that are available. So that CCTS, for example, has a K grant writing group that's ongoing right now, a group of 5 or 6, I think there are 7 people who are writing K awards for the same deadline. They're reading each other's material, helping each other go forward, giving critique along the way, really a valuable resource to help you with your writing. Then we'll have a section on outcomes, research, and personalized medicine. And then, so everybody who is in this course is working on some kind of research project. We'll have a couple of sessions on how to write an effective abstract, either for a scientific meeting or for a grant application. Then we'll spend about 4 sessions on you all giving oral presentations with slides about your talk, your research project. Some of you will have completed a lot of the research. Some of you will be just formulating the project and how it's going to happen. So don't be self-conscious about that. There's an opportunity for you to present where you are in your project and get feedback from your peers, get feedback on the science, but also get feedback on how to communicate what you're doing with your colleagues. And so that's actually, for many people, has been the most valuable part of this course. And then we finish with, as I mentioned earlier, a mock study section that'll be using a real-life K grant that was submitted, didn't get funded, had a review that the applicant responded to very effectively and did get funded on the second go-round. So we'll go through the process of what the study section does in evaluating the grant in ways that I think most people find really helpful in thinking about how they should structure their applications so that they're easy for a study section to give you the best review possible. Okay, now I think you all know from the materials we handed out at the beginning that you get a certificate of completion if you finish this 80% of the sessions of the course. So do register when you come in each day. We can't remember who was here every day unless you sign in. If you're signing in from online, please put your email address in and that'll help make sure we count you. One of the other things we do, so in the bioethics section, there will be a session on how the IRB operates. For those of you who are here, you'll be then given a chance, 2 at a time, to sit in on an IRB session. So you'll have to leave this class early. The IRB meets every Wednesday from 9 to noon. So you'll leave at 5 till 9 and go to observe an IRB session. And I think it's really, for anybody who's going to write a human studies protocol, it's a tremendous opportunity to see what the IRB cares about, how they think about the proposals they get, and how they work with them. I mentioned that we'll be helping you learn how to write an abstract. We'll reconfirm these dates a little down the road, but by April, mid to late April, we'll expect you to submit a written abstract. We'll have given some guidelines about how to do a good abstract before that, and then we'll have you each give your oral presentations in the Wednesdays between May 31st and the third week of June. Okay, any questions about the logistics? Yes.
So will the two individuals be selected?
So, no, we will set up a schedule. So Jean will ask you to bring in your calendars a couple of weeks in advance. There'll be a sign-up sheet, and you'll just, it'll be sort of first come, first served to sign up for the dates that are available. And so if you absolutely can't do this, it's not a required part of the course. It's just a really great opportunity. So, if you have conflicts that can't work. We've been successful in the past of having something like this happen at some of our partner institutions. We have people from institutions we haven't worked with before in this area, so we'll try to see if we can arrange for you to have an opportunity at South Alabama and Auburn and Pennington to interact with your IRBs also. Yes?
If we're traveling for certain weeks, can we sign in remotely even if we're normally here?
Yes, absolutely. So actually one of the big challenges we have is that we have too many people to give their 15-minute oral presentations. So we will have to set up several other sessions that will primarily be for people who are coming in online, although we'll try to have a mix of online and in-present presentations. But if you're based here in Birmingham, I really hope you'll manage to give your talk face-to-face because it's an easier situation. And there will be 4
learning sessions.
Sure.
Like if I'm going to conference one week, can I
Sure.
sign in remotely for that?
Yeah, I think for any of them we really can. And Jean will send out the instructions how to do that so everybody knows how. But I encourage you to join in the room because the conversation's a little easier face-to-face. Okay, so we only have 5 minutes to go here, so I'm not going to be able to say too much of substance about the mentor-mentee relationship. I just want to really encourage you to spend some deliberate time with your mentors and both to get the best things you can get out of the relationship as a mentee, but also recognizing that it's going to be sooner than you can imagine that you're going to be mentors and that you should be thinking about things that work for you that your mentor does to help support your career development and things that don't work so that you can begin to develop your own approach. So, mentor comes from the Greek. Odysseus asked his buddy mentor to look after his son during the Trojan Wars, and that's where this concept came from of someone as sort of a wise, trusted friend to help guide someone as they're developing. So I think it's worth being pretty explicit about what some of the goals are for the mentor-mentee relationship and considering it from your perspective as dominantly a mentee at the moment. You may be a mentor for people already, but from the mentee, you really want someone to help you progress towards your long-term career goals. Most of you here have an interest in clinical or academic medicine, but the NIH is very aware that successful outcomes are for people that end up in industry, in government work, in all kinds of different kinds of jobs. The translational map that you saw that the NCATS talks about has so many touch points with people with all different kinds of careers. All those people need to know how to work effectively together, and if we can use the training period to help people be really set up to be effective in that kind of research, that's a real win for everybody. In academics, you want somebody to teach you how to make steady progress towards promotion. You need to learn how to get your own funding from outside sources. You need to learn how to continually grow in a way that makes this a really satisfying career for you so that you won't have burnout as soon as you've written your 15th grant application and gotten 2 funded. So that's important to see ways in which people make this a satisfying professional career. Independence is a really complicated term for me now because what we're talking about in translational science is bringing a lot of different people together to do something. So nobody's really successful if they try to go out and set up their own little research lab and work on their own, and that you may have some impact, but your impact will be diluted by your if you want to work as a totally independent individual. So academic institutions are still struggling with how to help people advance professionally, acknowledging that they need to work as teams, but also realizing that they need to somehow show that they're bringing independent value to the research group that they're part of. And so that's a complicated issue, and it's particularly complicated in people who want to stay in an environment where they may continue to live in the same area where their training mentor is, because part of the moving to the next phase of life is demonstrating to the people who control your promotion and your salary and your professional advancement that you are providing independent value that your mentor is not capable of providing. And so that requires some real negotiating with your mentor to figure out how you each carve out areas where you will be recognized as the expert, the person really making it happen in your community. And that's not something that just happens without really intentional discussion. And it's one of the most complicated things. And I think we believe in mentoring teams partly to help you bring extra individuals to make those complicated discussions happen. And it's not always easy for the early career person to find out from their mentor how they're going to get their own part of the research general question that's their part, and not leave the mentor in a difficult position to continue to get his or her funding as well. So what's the mentor try to get out of this? And mentors don't do this just, well, some do it because they just find it really satisfying to see young people progress. It's hard to keep that up over the long term, and the really good mentors have a lot of people trying to have them as their mentor. So mentors, they do want to see mentee success. They view you as a way to extend their network of experience and people to work with. You generate new ideas, you're good at making connections with new people, you bring new dimensions into the work. So you help them develop a network, and you can help their research program to grow, and they recognize that. And so it should be really a contract between you and them about the mentor and mentee relationship being good for both of you. As you begin to recognize you're going to be a mentor, yes, go ahead.
Oh, I'm sorry, Dr. Chaplin. I had a question because I've been exposed to similar training. For this particular mentor-mentee relationship, do you recommend a contract?
Yeah, so I think some kind of written document is extremely helpful, and I'll just skip ahead to that because I think it's important. So I just make the point that a lot of people, most people think that you can't really teach how to be a mentor. I'm not sure I totally believe that. I think you can teach best practices, and you can help people recognize behaviors that undermine a good mentor-mentee relationship. And those are things that then you really have to work hard to make sure that you minimize their impact. And they're not things out there that are because somebody doesn't want the mentor-mentee relationship to work. They're things that are out there because the world is constantly bombarding people with demands and things that are going to interrupt the kind of communication that help a mentor and mentee to work as an effective team. So you need to just be aware of them and do things to minimize it. Things like, having scheduled meetings, making it clear who's responsible for the agenda of the meeting, and practical things that just make sure that good communication happens. We don't have time to talk about some of this stuff, but let's just talk about how to make this really work. So for the mentor, what they really need from their mentee is that the mentee has passion for what they're doing. You need this to be one of the most important things in your life. I think everybody recognizes that we all gain strength from our social environments, our families, our friends. So you can't ignore those, obviously. And for most people, probably if you come to the bottom line, their family is the first thing that's most important to them. and there are tensions between family life and academic life. The next most important thing for most people in this kind of a field is their work. And so passion around that is really important. You have to have some degree of discipline. You can procrastinate, but you have to know when to stop procrastinating. You can, use procrastination as a positive tool, but when it becomes a negative tool, cut it off. You must have honest and sincere communication. And so we'll talk just for a minute about what kinds of things can help that. And I mentioned that a lot of people nowadays have mentoring teams, and a challenge that will come up, so you heard among our group, several of you have mentors who are quite early career. So they actually can be spectacular mentors because they know what you've gone through. They generally don't have a huge network of competing demands that they're trying to deal with. They can focus more on your needs. There are some things they can't do very well yet either because they don't have a track record of bringing mentees to advanced careers. So they can't really be your main mentor for a K award, for example. They can't do certain stuff. So then you may need to bring in a co-mentor of somebody who has a lot of experience bringing people to the next level of career advancement. They may not be scientifically expert in your area of research, but they are expert in the process and they can be extremely helpful. You may need somebody who brings a particular expertise that you and your mentor don't have, but which your project demands. And there, whether they're a collaborator versus a co-mentor, depends really on what you want from them in terms of bringing you into a new level of expertise going forward. So anyway, you can have teams of mentors, and sometimes the team, they don't all give you the same advice. And so you need to develop expertise in how to work with mentors who give you multiple different kinds of advice and sometimes conflicting. So I think the things that for me really help you get set on a great relationship with your mentor is first being clear on expectations. And I put this under what the mentor needs to do, but I think it's really equally valuable for the mentee to be clear on what the expectations are. If your mentor may not know that you really need them to introduce you to people at scientific meetings, to do various things that can really advance your career. They may not know exactly where you're trying to go unless you tell them about where you're trying to end up, and so they can't really give you all the tools they need. So the mentor should help you by providing new opportunities. They should be your primary critic and be able to give you really balanced criticism. Ideally, they should go over your presentations with you before you go out and embarrass yourself in public. It's much better to get help from local people, and that's really, so I think, when we get to the point where you're doing your oral presentations, absolutely that's the mindset here, is that we're all here to help each other. Sometimes you'll get pretty brutal criticism, but it's all in the spirit of helping you to get to learn how to be a better presenter and how to get your ideas across. It's really all about communication. So work on that, and don't expect it to happen just when you're riding the elevator together or when you have the 15 minutes of what you had hoped would be an hour time to have really a mentor-mentee talk. You just have to keep working at making sure you have things scheduled. So I think some kind of written document is really helpful. So one of the best tools for people who do laboratory-based translational science is the MyIDP, which Science Careers puts out. And even if you don't do that kind of research, I encourage you to take a minute just to look at this website. So it has a substantial self-assessment part for the mentee, a chance for you to sort of articulate for yourself what your long-term goals are. It lets you then print out parts of it that you want to share with your mentor. It has parts of it that you may use just for your own thinking and developing your ideas. And it's easy to come back and revisit it every 6 months or more often or less often. to modify it as your needs and skills change and develop. So I really encourage you to take a look at that. There are many other tools for helping you to map out a plan to work with your mentor. The CCTS has a mentoring contract. Actually, I was sort of stunned that there was a group that recommended against using the term contract because the mentee may ultimately try to bring action against the mentor for not fulfilling the contract. So you might, to make your mentor feel more comfortable, you might X out contract and write in agreement or something less litigious sounding. I'd like to point out that really, so I'd encourage you to spend some time learning about mentoring as nascent mentors yourself, but also so that you can get a sense of what you should be expecting from your mentors. So we have a weekly case studies and mentoring program here. We meet Fridays at noon, and the next Monday we do the same cases over again in case there are people who couldn't come on Friday at 8 in the morning. Spend about an hour talking about different topics in mentoring that help sort of eventually go through over about an 8-week period, go through all of the key domains of effective mentoring. You don't need to come to them in any order. You can come to 1, you can come to 5, you can, again, we give you a certificate if you come to all of them, but it's repeated about every 10 weeks so that if you miss something that you really wish you'd heard, you can come again later. And people who have done that, many of them find it really a valuable discussion opportunity. There's something called the Mentoring Academy that you'll see flyers for in April. I really encourage you to participate in it. It has some case discussions. It has a really interesting segment where there's a 2-hour session where a small acting troupe acts out a mentoring aspect of the mentoring relationship and does it in an interactive theater way where a director of the discussion brings the audience into discussing what's going on stage. And it's really a great way to really see the mentoring relationship come to life. And then the CCTS also offers more sort of compacted opportunities where the 8 topics that get discussed in the case mentoring workshops get presented over 2 3-hour sessions on a couple of different days. And they use the mentoring curriculum, which is something that was put together by a group at the University of Wisconsin. I can give you a copy of their manual if you're particularly interested. It's a really great resource. So I hope really my message is that hope you'll spend some time, if you haven't done it already, just talking with your mentor and saying, you know, that gray-haired Dr. Chaplin said that the mentor-mentee relationship is most effective if we really communicate in a deliberate way about what the relationship's all about, and have a document in hand to work with to articulate your own ideas about what you want from the relationship, what you hope your mentor will deliver on. If your mentor doesn't feel comfortable with some of it, you need to know that. Doesn't mean the relationship is going to go to hell. It just means that you may need to get some special supports from somebody else. But rather than not getting them, it's best to have had that discussion and to know about it. And you also, if you decide you need a mentoring team, it's way better for both of you to agree on who the team members ought to be, rather than you going out and just finding some people and then later finding out that one of your other co-mentors maybe really doesn't, that there are relationship issues, a history that is not productive for that to happen in your case. You don't want to be in the middle of a problem. So anyway, take the time to talk about it, and feel free if you have mentoring questions that come up, drop in at one of the CCTS mentor sessions, and we'll be glad to talk about it. We all respect each other's privacy and take care of each other through those discussions. So, sorry we've gone over a bit. It's a large group. I'm glad we had a chance to.
If anyone, I know we have gone over a little bit. Good morning, I'm Andy Smino. I'm the communications director. If anyone has time for a quick photo, to line up outside. I know it's very cold, but you got to go outside anyway to get to your next appointment. So I'll be outside waiting, and if we could just get everyone together, it takes like just a minute. It'd be wonderful to participate in the cohort. And welcome.
It's been great to meet our team members. Okay.
Just that. It's really welcome.
Right. I'll get rid of our